and the speakers and about. I had to go a little deeper. So the title and the material, whatever is there in the presentation, may not match. I'm sorry for that, but we'll have a healthy interactive session. Okay. And now I would like you to do something for myself. Okay. For ourselves. Am I audible? Yeah. Just take your hand, look at back, do this. Yeah. Now all of you try to do this. Try to do it on the opposite. Right? Yes. How many of you could do? How many of you could reach the fingers on both the sides, right and left? How many of you? No, I want both. I know one side it will come easily. The other side is the problem. How many of you could do it? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Good. Excellent. Good. Oh, sorry? Really? Come on, get up. Turn that side. Just try to do that. Good. Okay. Now this side.
What side?
Good. I think this keeps you awake. Am I audible to the last? No. So coming to the topic. As I said, we are going to have a brief outlook of what sports rehabilitation is all going to do. I know you are well knowledgeable people around here, so you should be aware of what is going on in the present scenario, but we will try to discuss and share whatever we have. So I may not know everything what you know, and the same vice versa. So let us have a good interactive sessions. Nothing to make notes about, sir. Put down your pen. There's nothing great in my presentation. It's all there in Google. Don't worry. Okay, let's have some healthy interactive session. Okay, that's my normal practice. Before I could start my presentation, I always salute my teachers, my guru. And in fact, the person whom you are seeing on the picture, maybe the screen is not that bright, but the person is next to me is the brightest person. He's Dr. Meghalathanagaraj, he's my PhD guide, and he was a great inspiration. Normally, a PhD students, what is I think you people will be guiding PhD students, right? Are you doing it? Okay, good. Who is the nightmare for a PhD scholar? Sorry? Guides. I didn't tell that, she only told me. So, but for me it was not the stature. It was completely different. Okay. In fact, I used to scare him a lot. But he was guiding me so beautifully. Hats off to sir. With due gratitude to Dr. Meghalathanagaraj, I am going for my presentation. Okay. Who is the person on the screen? You all know. Sachin Tendulkar. What do you think of him whenever you see his picture?
The god of cricket.
Sorry?
The god of cricket.
God of cricket. Then?
Achievements, simplicity, achievements.
Simplicity, achievements.
Attitude.
You always see on top what is happening. Achievements, attitude, everything, no? But, sorry? Patience, man of self-confidence. Hard work. Sorry, sir? Dedicated person. Okay. Social service. Okay, let us stop with this. Okay. But if a physiotherapist is looking at Sachin Tendulkar, he was a man of all complaints. Okay. He had neck pain, he had back pain, he had tennis elbow, he had ankle sprain, he had knee sprain. Okay. What all conditions you have in orthopedic textbook for a physiotherapist, he had everything. Okay. So, being a physical education experts, what do you think about? You all were listing about what the best Sachin Tendulkar had. But if I'm trying to outline, it was not me, this was from a slide from a famous newspaper cutting. It's not my work. Okay, it came on a national newspaper. So now tell me, as a physical education expert, you tell me now what do you feel about Sachin Tendulkar? Overuse. Anything else?
He has worked so hard.
He has worked so hard. So hard, all hard people, working hard people will get this.
Maybe.
So if I don't have injury, I don't work at all.
He's focused. He was focused. So he has trained himself.
Okay. Madam was highlighting about fitness. Do you ever think somebody who is fit will get all this? Please let us talk frankly. Sachin Tendulkar will not feel bad. He's out of the scenario. He can be bowling, and nobody is recording it.
No, regularly when we do some activity and like as you said, nutrition, we know that. So somewhere when we lack, we get injured.
Ma'am, you do exercises regularly?
Yeah.
Do you get back pain?
I don't get back pain, but overdone.
You are a physical education teacher. You are working every day. You do exercises, but you don't get back pain. He is a player at an elite level who is performing at the national, international level. His back, he's getting back pain. What does it mean? There is something lacking. I'm not saying he's not fit. I don't use the word he's lacking fitness. But there is something happening. As man rightly pointed out, overuse. But why not all the 11 players get back pain? Why only Sachin Tendulkar?
He has started freshers early.
He started from childhood. That cannot be the... Okay. There are a lot of speculations about his incidents of back pain or neck pain or tennis syndrome, X, Y, Z. And we physiotherapists, as such, we are very grateful to Sachin Tendulkar. Why? Because he made all physios very famous. Okay, he went to Bombay, 2-3 therapists became famous. Now they are the richest physiotherapists in the entire country. Okay, he went to New Zealand, then he made some people rich. Okay, so wherever he goes, he makes people to survive. So, in other words, we are grateful to Sachin Tendulkar for giving us a good opportunity. Yeah, that's a right thing. Topic, I'm going to go in depth about return to play. I just want one of the people to tell about any of the famous people or athlete after injury you have put them back in sports. Anybody? From this group. You did it? No, everybody can. But anybody from this group?
You mean a player we put in?
Yes, sir. After injury, you have put them back to normalcy.
Immediately on the day, sir?
Not immediately on the day. They are
After
back
recovery.
and still playing to their earlier level.
As a player, I play, but
No.
students, they have stopped.
They have
Many
stopped.
students.
Anybody? Agnes, sir, I think you will have a good experience. No, sir. Your experience. In your experience. When you yes, please, sir. In your experience.
Now, I have trained a lot of international players also.
After injuries, sir?
After injuries, they have come back to normal positions. During the competition time, one player got an ankle injury. After 1 week or 10 days back, again recovered and played for the All India competitions. It happened.
Is he still playing, sir?
No, it happened long back, 2000. And afterwards, she recovered and she got a job.
Okay, great, sir. Give a great big round of applause. Anybody else? Anybody else?
It doesn't come under our zone, sir, domain. In the sense,
No, actually,
no,
sir,
we don't handle such cases unless until we officially get the permission, they can play.
In your experience, even a student who was playing in the zonal level or state level or at least school level, had an injury, had a surgery, came back, he could perform the same level. You have done, ma'am?
In high school, one boy got a knee injury, swimmer, and now again he has come back than the previous experience.
Great, madam, great, wonderful. So, this particular topic of race, for every person, even a small finger fracture, phalanx fracture, can have a devastating outcome. So, just imagine return to play is a very, very crucial. For a normal people, you train them, they become elite sportsmen. they bring laurels to the school, to the community. That doesn't matter. But what really matters is to bring back an injured athlete back to this old form.
Shall I tell you one thing? Actually, I was also KV student. I went for playing hockey. Right from 8th. I have been playing hockey right from 8th standard. I am a KV student, and I had disc prolapse. And actually, as a player, we forget once we go there. Whatever I underwent, all like injection and all that. I remembered it later when I was like in the delivery area where there my father told me you had this. Actually, it happens with adolescent children. School children, they forget about it and they get into play. This is my...
So ma'am's news is that what she's trying to give a lot of information. Kids recover faster. It's easy to manage.
I feel so, because I forgot about it.
That's what the madam's version is about. Okay? Hats off, madam. Hats off to your courage. Okay, so return to play. What does it really mean? It involves so many people, domains, where an individual is brought back to the normal. Earlier, that means that he was playing in an international level. After injury, he should come back to the international level. That is what the return to play really matters all about. Okay, so that is return to play is a very important thing. What everybody is needed to be concerned, and that is going to be a focus of topic today. Okay, what really happens in return to play? A person has an injury, followed by which he has got a serious trauma or a fracture or a rupture or a displacement or a dislocation, XYZ has happened. The orthopedic surgeon has operated upon him, and there is a point at which he comes back to the ground to get back to the game. So a medical discharge coming out to the game where you have a competitive, not a normal level from medical discharge. That's where the crucial role of physical education teacher comes into play. When this happens, when this particular process of the individual coming from a hospital back to the ground, who is actually responsible for it? First, you will come across, anyway it goes, any injury comes, you have a physician, team physician, sports medicine specialist comes. Then comes the physiotherapist. Then comes the coach. That is the coach means you have the game specific specialist. Okay, whatever, he is a footballer, you have a football coach for that game. And a very important constituent of this particular team is your player himself. He is the one who is going to take the call ultimately. Okay. So, if you see this particular slide very carefully, the topmost person is going to be your team physician. He can be a sports medicine specialist or an orthopedic surgeon or a sports specialist. So from him, the next comes your physical therapist, who is standing in between the coach and the surgeon or the physician. The last is going to be the coach. That's where you all stand. You play a very critical role. You anchor the individual back to the competitive level of sports. So what really happens in rehabilitation, I'm not going to go into the depth of it. You can see there are three phases. One is very protective, the other one is very open. The extremes, the left extreme, what you are seeing in the screen is a protective phase, and the right extreme is called as the competitive and less competitive level, and the middle one is intermediate between the protective and active level. So I'm not going to go to the depth of it unless and otherwise you have some questions to ask. So this is what is all going to be in the rehabilitation process. And this is just a slide to be on the lighter side. Okay, a person comes back to the elite level of games. Who is going to take the credit? Who is the hero of this show? After the individual has gone in surgery, comes back, gets back to the field, gets a coach, the coach coaches him, he goes to the international level, he gets the cup. Who is the hero here?
The coach.
The coach himself. Anybody, any other surgeon? Himself. What about the surgeon, yeah?
The doctor.
What about the physician?
Physiotherapist.
What about the physiotherapist? We are poor fellows. We are standing in between. As you rightly said, the full credit goes to the individual, that is the sportsman himself or herself. Because unless and otherwise that person is involving himself, he cannot, nobody can do anything. The doctor does his job, therapist does his job, the coach does his job, the player has to do his job. And it's not easy, believe me. That's where the role of every constituent of this team comes into play, and that's where effective return to play happens.
So isn't that not very obvious? The player obviously has to play sport, but unless and until you have a proper guidance and the coach who can lead him after the injury or after his comeback, don't you feel that the coach plays a vital role there? Whereas, as you rightly said, it's very obvious that the individual has to.
It is something like asking, in a ship, who is important, the captain or the sailor? It's something like that question. Okay, and you need a good captain. I do understand. You need a good
The
direction.
ship obviously carries a sailor.
But the sailor is sailing the captain. See, it's both vice versa, sir. I'm not contradicting you. You are right in the perspective, but there are some more perspectives which I would like to explain you later. As you rightly said, the credit goes to coach, the surgeon, the therapist, etc., etc. But does, in this international scenario, does every sportsman after injury do they return back to the normal earlier pre-injury levels?
Not necessary, sir.
80%, 70%, 60, 50?
80% they come back, sir.
80% they come back? Sure, sir.
Yeah. They come back, sir.
Only 25% will try
International,
to come.
80% people come back, sir.
And they keep getting injuries, that happens.
So what you are telling is your experience. I hats off to your experience.
Ronaldo, football, as actually after the injury also, he was playing the midfield. And the coach specialized him not to play, beyond the midfield and be in the midfield and see that you have the scoring. He is the main scorer. So he emphasized him to be in the even after the injury. But he was limited to playing, not running here and there and all that.
You good name, sir?
Varaprasad.
Yeah, Varaprasad sir has a good message. He said he was talking about Ronaldo in this position and the coach, how he came back to the international level. Let us get into that in few slides later. So coming back to the topic, what I wanted to tell you is not all the players who are injured are coming back. That's my point. I'm not saying, see, you have a person who has been playing table tennis at the national level. He had a very small fracture, after which he could not come back to table tennis. Okay, what is the purpose of having 80% of it? Table tennis doesn't demand you such a big fitness, such a huge fitness. But if one or two people, let him be a school student, let him be a national soccer player, international tennis star, whoever it is. But injury, rehab, he has to come back. But it doesn't always happen. Where is the lack now? What is the lack now? Where we have to work upon. And what you gave, sir, was an example out of millions. You cannot say all of them. Nobody can say that. In that scenario, that cannot happen in any field. I do agree. But today's topic, I'm trying to focus more on the return to play criteria, which is going to play a very critical and a crucial role as far as a coach is concerned, as you rightly said. So the statistics here, what I have highlighted bottom, what I have quoted as a reference, it says 70% of them come back to sports and only 30 to 40% come back to their pre-injury levels. That's an important message what you need to understand. The pre-injury levels matters a lot. So the pre-injury levels, they are pretty slow, very low actually. 1/3 of the total outcome, whatever you have to do. Are you with me? Yes. Now all of us will stand on one leg. Come on, get up. If you are old enough, please sit down. Nobody will sit. Sir, please move. Okay, now stand without any support. One leg. If you are old enough, you can sit. Okay? Good. Hope you are not holding anything. You have put your foot down, gentlemen. You are youngest of all. You are putting it for the 3rd time, and now the 4th. Now the 5th. Now the 6th. Yeah. Okay, now on the opposite leg. Without holding. Good. I know people are grimming, not happy with me. I woke them up. The lunch was good, I believe.
Ice cream was good.
Ice cream was good. Good. Relax. Okay. Now I have a question. To you all. I was thinking I'll be seeing all old people. A lot of young people here. I'm very happy to see you all. Now, let us ask this youngster. Your good name, sir? Jane. Sharad. Standing on both the legs was same or different? What do you call this as?
Different, sir.
Different. What do you call this as?
Balancing.
Anybody in this crowd?
Power of leg and
Balancing.
Balance. What do you call this as? Okay. Madam was trying to reach on both the sides. Not all were able to reach both. What does it mean?
stretch.
Muscle stiffness.
Flexibility. Good. But what is there on the one side is not on the. Please. What is there on one side is not seen on the other side. What do you call this as? Okay, suppose you have a student who had a right lower limb fracture. Okay, right lower limb fracture. You strengthen. To what level? To the opposite level. If you have right limb fracture, then you always have a comparison of leg. So what do you call this as? This is called as Symmetry Index. Symmetry means same, equal. Right and left has to be equal. Let it be the upper limb or the lower limb. So I just want to pass on this message to you all. Symmetry Index is a very important criteria when you come back to sports or when you assume or start to play at an elite level. Okay, so if you see, we have asymmetry. All of us have asymmetry. Most of us are right-handed. Some of us are left-handed. So you are good in right and bad in left. Do you agree with this, with a sportsman?
Yes.
You agree? You should not. You should never agree asymmetry. Okay, symmetry should be the target. Okay, especially with the upper limbs. Lower limbs, it is very difficult to find out, but I see Mr. Jain. He is having gross asymmetry. Okay, watch out. Okay, having said this, yeah, you're all with me?
Yes, sir.
Partially awake?
Fully awake.
Thank you.
You are keeping us.
Okay. So, what do you really need? You need an objective evaluation. You need to say, this is this many kilos, this many grams, this many meters, this many liters. So, you need to evaluate and say, yes, this was on the left side, this has to be on the right side. Just now I mentioned, you need to measure the strength and the strength has to be symmetralized on the other side for you to get back to the sport. So, symmetry plays a very crucial role. Objective assessment, it gives you a state of fitness, the functional ability. And for sports, there is an adaptation which is required. That is called as adaptability. So, this adaptation will be the highest degree of strength in sports. So, that has to be measured. How do you do that? You have some tests which are standardly followed at the international level. They are called as, they should be valid, they should be reliable, and they should be suboptimal. It should not be overtaxing. You have called in for an evaluation and do an evaluation. In the process of evaluation, you again create a problem. That just cannot be justified. That is a blunder. So it has to be always suboptimal. And it has to be universally applicable. What is being done in US has to be done in KV Pondicherry also. It is nothing like you cannot do that, you are able to do there and you cannot do here. It should be uniformly applicable and it should be as simple as possible. So you should have some objective tool for a player to return to sports. That's the bottom line. What are the components in this? You see there are something called as internal and external. What are the internal components normally you look for? Suppose the patient had a major injury, a player had a major injury. You look for the parameters which are physiological in nature. For example, heart rate, body temperature, okay, the expansion, the joint position, whatever is in the physiology. And there is something called as external. The external parameters, they are mostly a sports parameter. For example, the quickness, the agility, the endurance, the power, everything comes into the sports parameters. here today's class, I'll be very glad to discuss this particular publication which has been done in the year of 2010. This looks very attractive. I think we have to just go through that and modify according to your requirement. These people have said 3 steps. Okay, the first one is going to be predominantly health oriented. The second one will be sports oriented, and the third one is going to be a little of mixture of both the societal and the individual level of decision making process. So this Creighton et al. Has devised this model. It looks very good, and I'm not going to go to the depth of it. I'm just going to go touch and go. In this, it is going to be predominantly a medical record. It starts from the patient's name, age, sex, occupation, history, and his ability levels, girth, etc., etc. It is completely medical, and it is usually done by a sports team experts who are medically qualified, where the physician and the physiotherapist will come into play. The second step, it involves a bit of coach oriented with physiotherapist collaboration, where he is going to identify the alignment, the strength, the girth, the symmetry index. All these things will be taken care at this level. And the last one is going to be more of a political thing, where the litigation part of it, the influencing factors. Suppose a team is wanting the player to come back, or the player wants to get back to the team, or money is playing behind this, or any litigation is there. So it is going to be out of these 2 domains where you have a much of role to play nowadays. How many of you really think the psychological part of an athlete or an injured player plays a critical role in the outcome, as Madam was highlighting before? Yeah, the psychological readiness is something which plays a crucial role in re-injury. For us, the greatest demand is to put back to a player. If re-injury happens, that's a gross failure on our side, not on the individual, because we are not anticipated the risk factors which can potentially lead to re-injury and which can spoil the entire career of the individual. One injury coming back itself is a huge success, and suppose he has come back and again re-injury happens, then that is unforgivable, and most of the time it happens. So if you see the psychological readiness, it plays a very crucial role, and these authors have studied and they have seen the stress is the major factor which leads to re-injury. Okay, it is not the fitness or the lack of the surgeon or the therapist. It is a psychological lack of psychological readiness which potentially leads to injury. Okay, now coming to the end part of the slide. Who has to play a critical role? As Sir said, the coach. Few said it's the player. Some said it's the doctor. Okay. Now let us discuss whose role is important.
Combined together.
Combined together.
Everybody should play their respective role and in the right manner. And together teamwork happens, the excellence comes.
Physiotherapist, the physician,
That's the problem is, in a democratic country, it is very difficult to define the borders. Okay, no politics. I'm just talking about sports rehabilitation. It's very, very difficult for you to define the borders. You say, you're a physiotherapist, I'll definitely step in and see how the player is playing. Being a coach, you will definitely come and step in and see how hot test I'm doing. It's definitely happening, but we don't have a definite, strict, laid down norms for us to practice. We don't have a system with which we have. Just now I was talking about a 3-step process where you can put back the individual to return to play. We never have does anybody follow here a system? Return to play, do you have a criteria? Have you ever heard about these criteria? No. That is the flaw in our system. It is not individual flaws. It's a problem with the system. We don't have a system where it says this player can get into this particular level after clearing this. There is no such criteria. It goes with the likes and dislikes of the player, the coach, or the surgeon, or the therapist.
Yes.
So the system is the one which is to be found with flaw. Having said that, here most of the literatures highlight the importance of sports physician taking a major role in taking the call whether they can go back to the earlier levels. But there was an interesting study which was done in Canada, I believe. Yeah, it was done in Canada. They have given a questionnaire asking that whom do you think can have a better call? Okay, so they have done a study on 750 athletes who had an injury. You know the surprising part, they said the doctor came first, the physical therapist came next, the coach came the third, and the fourth one was a massage therapist. Okay, massage therapist was there, and a few of them said myself. Okay, so this was just a critically analyzed paper where they did a survey, and they wanted to feel from the player's perspective who can have a better call on return to play. So in that, again the team physician comes on top. It depends on his skill of surgical acumen, etc., etc. Fine. They believe, again, the doctor is the god. Okay. So the rest comes next. So fine, but the top player is going to be your team physician, below which you have a wonderful team contributing and playing their defined domain to be delivered. Okay. I can see some faces from north, from south, from east, from west also. West I don't see much. Anyway, how many of you recommend or practice yoga as a curriculum which has to be followed on students? Therapist with some amount of knowledge in yoga, I strongly believe the mindfulness by the practice of, not only with the practice of yoga, it can be anything. You are a spiritual person, you do spiritual practice, because of which you are mindful, you are welcome. Mindfulness is something which has to be practiced by every athlete, every sportsman for that matter. It has to be emphasized by some means. Here I am to endorse yoga as one of the means with which you can instill this mindfulness in the individual, which can play a better role in return to play or return to sports activities. I would love to discuss or argue. Anybody there? Anybody? I would love to argue. If anybody wants to say no against my views?
No, we are with you.
No, mindfulness for sport people, not yoga. Yoga is a mean. It's just a language, just a medium. What I want to ask you is, do you have any other equivalent practice for mindfulness? By the way, what is mindfulness?
Mindset.
What is mindfulness?
Mentally prepared to execute the goal perhaps.
Being motivated
Motivated,
and then
Confidence.
concentration. Sorry? Yes, all of us are right, because mindfulness is a therapeutic approach. It's a treatment for you to have the mental strength for the challenge whatever you are facing. Okay, it's a therapeutic approach. So the mindfulness practice is something, as a physiotherapist and as medical experts, they are trying to instill now on patients with chronic pain. Have you heard about this word chronic pain? Yeah. Chronic pain is an important area where physio is involved. There, this mindfulness comes into play. Not only in this, all neurological disorders, mindfulness plays a critical role. Yes, madam, do you have a definition for mindfulness? Just now saw that? Yes, madam. You have any definition, please? You have any other definition? No. So, mindfulness is a therapeutic way of approaching things to come out of an issue or a challenge or a critical state, and that is very, very important for a sports person, which we have to instill. And I just feel yoga is one of the ways where you can instill this quality upon them. Yeah, take home message, as Sir said, we have people with different domains different challenges and different technical expertise and challenges with one common goal, that is the individual coming back to the normal situation, normal pre-injury status or the elite sports level. So a teamwork is very important. I just feel the team management has to have a good amount of understanding between the team physician to the player. They should be highly interactive, social and cordial with each other, so that the ultimate beneficiary is going to be the player and not anybody else. A player is an important criterion for the complete return to play management is concerned, and we need to have a thorough interactive game or a team effort for the individual to come out. Having said that, thank you for this wonderful opportunity. I made you to sleep enough. Thank you, thanks for the wonderful opportunity, and I thank the authorities for giving me this chance to speak, and thanks to Veera sir. Veera sir, not here.
Psychological stress you said, psychological stress you said, you can relate on that little more. And then thoughtfulness you said only you have to do the therapeutic. And what are the other means of therapeutic for thoughtfulness other than the yoga? You said spiritually, I don't think everybody can build up their my thoughtfulness and truth spiritually unless nothing is ready. Hope I'm going the right lines.